This
So
conference will now be recorded.
perfect. So your conference is recording. So I'm gonna go ahead. I think that my webcam will pause for this, but I'm gonna shift over into the presentation. I am going to make sure to read the things that are on the screen for those of you who are called in and may not have a screen available to you. So this is our first COVID-19 update for Wednesday, March 25th. This is the first of the current 3 that I do have planned out. I wanted to have these so we can, as a group, kind of be on the same page and be talking to each other and communicating as needed. And we'll kind of go through that. So, kind of first off, oh, I'm drawing on this, not, there we go. So first off, I do want to point you all to some very important COVID-19 resources. So for the most up-to-date information, you can go to the City of Dubuque's website, to the Iowa Department of Public Health, and to the Centers for Disease Control and Prevention. The websites for the City of Dubuque is www.cityofdubuque.org. And on that page, there is a link or a picture that sends you directly to COVID-19. Otherwise, you can do www.cityofdubuque.org/COVID-19. So that would be /COVID-19, no dash between COVID and 19. The Iowa Department of Public Health, you can find them at idph.iowa.gov, and theirs is a longer link, but if you go directly to their main page at idph.iowa.gov, there will be a coronavirus page there, or page right at the top, and I'll show you all those as well. And for the CDC, you can go to www.cdc.gov, showing you those web sources right now. So the City of Dubuque, we are putting out daily updates. One unfortunate thing that we have heard is Dubuque County has been unfortunately the first COVID-19 related death yesterday evening. So that is very unfortunate. But COVID-19 for the City of Dubuque will be posted here. You can look back to the mayor declarations as cases come up, information for the city, as well as any sort of FAQs, symptoms, how the virus spreads, and what we can be doing about it. So just remember, wash your hands, cover your mouth when you cough or sneeze, and stay away from people. For the Iowa Department of Public Health, you can see that we have here right at the top, most of their information is related to the COVID-19. They are going to have information from Governor Reynolds as this progresses. So just make sure to visit their website. And then the Centers for Disease Control will have information on how to protect yourself, symptoms, how to protect other people, and to prepare. So those are all very good information. I will send out this PowerPoint and the information here. So if you are not viewing my screen right now, or you would like to dig a little deeper, you can do that. So back to our PowerPoint. If you or somebody that you know needs help, resources, or referrals, please call 211. That is going to be the best place to get information about the local resources right now. 211. So you can just dial that on your phone number or on your phone, or you can visit 211.org. And there are alternative phone lines that you can reach on there as well. So that would be, any sorts of needs right now, whether it be rental assistance or food assistance. Along with that, because you are all current AmeriCorps members, there are, when it comes to things like SNAP, or Medicaid, things like that. Those are resources that you can utilize right now. If you do need to do that, we are compiling information to send out this week to help you with accessing those, just accessing that information or how to apply it. I will also be sending out an already pre-made document that basically states that you're a current AmeriCorps member and that your service allows you things like your income for AmeriCorps does not count towards like SNAP benefits as income. So a couple things to be considerate of if those are things that you are in need of. Additionally, definitely take use of or take advantage of the member assistance plan that we have. That is for you all to be using, whether it is mental health related or resource or referrals related, anything that you may need, please utilize that resource as well. Again, it is completely confidential. I am not aware of anyone who does use it or how often somebody does use it. So do not hesitate or feel that you would be, anything would be known. It is completely confidential. Moving into today's agenda, I am going to go over the policies that I sent out at the beginning of last week for our program specifically. We're going to review a little bit of the CNCS and the corporation information that relates to AmeriCorps and COVID-19. We're going to touch on the unemployment benefits as it relates to AmeriCorps. And we're going to look into some opportunities for service. I know, while the schools may be closed and most of our sites are also closed, there are some things that I think we all feel like we would like to be doing. So we'll figure out some ways to get us engaged. So moving from there, the first policy I want to review is the vulnerable populations serving as AmeriCorps members during COVID-19. So currently serving AmeriCorps members with the AmeriCorps Partners in Learning Program who are at a higher risk, as defined by the cdc.gov, as older adults, people who have serious chronic medical conditions like heart disease, diabetes, lung disease, or AmeriCorps members who are ill, are prohibited from accruing service hours outside of their home during a state of emergency. Any service that is completed during this time by these members must be done in home. So if you are at risk of COVID-19, I do not want you to go out as part of your service to participate in putting together meal related things or hunger related projects. Anything that you do for this AmeriCorps program, we would like it to be done from home. And that is because I do not want you to feel that you need to go out or put yourself at risk or put somebody in your family at risk. This is a time where the ethical side of me is I don't want to be a reason why anyone would get sick. So for AmeriCorps, we ask that anything that you do be done in home, if anything can be done at all. So again, if you are vulnerable, stay at home. Moving into continuing on-site service during COVID-19, we do have a handful of AmeriCorps members who are serving on-site at a limited basis because their site is closed off to the public. So currently serving AmeriCorps members with the AmeriCorps Partners in Learning Program who are reporting to their service sites are expected to maintain the CDC recommended precautions for social distancing. So again, that is 6 feet. AmeriCorps members must regularly wash their hands and practice appropriate public hygiene. If the AmeriCorps member begins to feel ill at any time, they must contact their supervisor and director and immediately report home for self-quarantine. So this is in relation to anyone who is currently serving at their site, whether that's an office or something like that. Or if somebody who is not a vulnerable population decides to go and support a hunger-related cause and engage in an appropriate service, which we'll talk about, that I have approved. They are expected to maintain social distancing, to practice public safety hygiene, so washing their hands for at least 20 minutes, and just being very, very aware of, their own health and the health of others. So if you have the ability to serve outside of your home and you're not at risk, that you still maintain and are expected to maintain the CDC precautions. Living allowance during COVID-19. Per guidance from CNCS, programs have the option to continue to pay AmeriCorps members if their host site organization closes down due to COVID-19, or if the AmeriCorps member cannot serve at their host site due to illness. With this guidance, AmeriCorps Partners in Learning will continue to pay the AmeriCorps members their living allowance, regardless of shutdowns or the closing of service sites. Living allowance will be dispersed via direct deposit. If you are currently not receiving your checks via direct deposit, you will likely receive communication from the City of Dubuque Human Resources Department to address this. Again, today, City Hall has been shut down, not just to the public, it is actually shut down to all employees. Somebody began displaying symptoms, whether of the flu or COVID-19, we do not know, but City Hall is now being disinfected. So I don't actually know when the next group of people or when the City Hall will reopen. So at this time, if you do not have your checks done via direct deposit, we really need you to consider doing that and moving towards that. So if you are not on direct deposit right now, please contact me. I'm pretty certain that everyone is, but again, if you are not, please contact me so we can move forward with that. Again, living allowance will maintain during this time, whether people can or cannot serve. We will not be suspending any contracts, and I do not plan to do any compelling personal circumstance exit at this moment. Come April 13th, we will review that again to see what can be done. I will be honest that I don't know. I don't know what's going to happen. So the best I can do is plan and continue to monitor the situation and just have very candid conversations with everyone. So, but it will not affect your living allowance. You do not have to worry about this income at all during this time. Whoops, I skipped one. So compelling personal circumstance exit with COVID-19. So I know that a lot of people are probably worried about their hours right now and being able to complete their contract. COVID-19 is a valid reason for a compelling personal circumstance exit if you're unable to reach your contracted service hours because, one, you've missed service time due to a host site cancellation. Two, missed service due to becoming ill during COVID-19, and or three, the member is a vulnerable population as defined by the cdc.gov at a higher risk of COVID-19, and my policy has determined that you cannot serve outside your home. So we do have a CPC policy in our member handbook. I will be reviewing CPC exits on an individual basis. I don't want to have this policy be abused, but in the situation that it comes down to April 13th, maybe the schools do in fact close to the end of the year. I don't know, but if that were to happen, obviously we can't really tutor students. So we would look at how CPC exits can be done and what that looks like for each individual person. So I do not want anyone, I know there's a lot of concern right now, not just about your AmeriCorps contracts, but about the safety of you and your loved ones. And I do not want to add any additional burden to what is happening. So do not worry about your AmeriCorps contracts during this time. Please focus on yourself and focus on your safety. And AmeriCorps comes after that. We will, maintain communication with all of you during this time, but we are here to support you and make sure that you are taken care of and that we will help you in any way that we can when it comes to your contract. So moving into COVID-19 information from CNCS. So we do have, so I'm going to flip over here to, so this is information that is kind of related more for grantees. I believe that everyone should have received a message from CNCS during this time. Oh, apparently I'm not allowed to access that, but there should have been a message that was sent on March 17th, 2020, basically with the Corporation for National and Community Service, just letting you know that during this time, there's a lot up in the air and that we are all doing the best we can to support each other, and that members can be, engaging in different ways across communities. So this page that I have pulled up now, for those of you who can see it, it is nationalservice.gov/coronavirus. So that is nationalservice.gov/coronavirus. And this is the information from the Corporation for National and Community Service related to questions that they have received. Again, if you would like to view this on your own, I will send it out. But this is kind of general questions that are coming from directly from the top that AmeriCorps answers to. So this is information not just for grantees, but also for members. So as you can see here, they have questions that were updated on March 19th, answers that occurred back on March 12th. And so they're consistently reviewing and adding new questions. So basically, this states that CNCS is closely monitoring latest developments related to COVID-19. So, this talks about in the case of service sites closing, or if you yourself are showing risks, just all of this information. This is a place that you can go and to read. A lot of it will recommend that you come back to your program and talk to us specifically. So again, most of the questions that you have will likely be answered by myself. And if I cannot answer them, I can find the answer with the State of Iowa Commission. We are maintaining regular communication about AmeriCorps contracts and the impacts of these things. But feel free to access this information and you can read up on it if you have any questions or if you're just curious about it. So back to PowerPoint, unemployment benefits reminder. So this is just a reminder that AmeriCorps members are not eligible for unemployment benefits as it relates to your AmeriCorps contract. However, if you are working a second job or another job, you can claim unemployment benefits if that employment has been impacted. So, but you cannot claim it for AmeriCorps service. And because of that, we are maintaining your living allowance to be active during this time. So this brings us to some opportunities. I will be honest that during this time, I have felt a little bit helpless, or, just a little bit, not as positive as I would like to be. So I've been trying to think of different ways that we can all stay engaged and we can all make these impacts. Not to speak for anyone, but I can assume that many of us are concerned about the kids that we're working with. And we are working with the school district to try and figure out what ways could we utilize our AmeriCorps members to work with our students. I don't know what that looks like yet. However, there are some things that I'm thinking we might all be able to participate in. I don't know, what all that really looks like, which is why I want to bring it to all of you. as opportunities to work with me on this. So one of the things that I think would be a lot of fun and I think would be well received by our community would to be do daily story time or literacy Facebook Live events. So basically, you would not have to do this on your own personal Facebook. We would give you access and connect you onto our AmeriCorps Partners in Learning Facebook page, and we could conduct a story time activity or a literacy activity over Facebook. You can plan them, from your homes and engage, the community that way. I would work with the city of Dubuque and our program partners to get that shared out. But I was thinking we could maybe do it 2 or 3 times a day. So maybe somebody wants to do 9 a.m. and do a story time on Monday, Wednesday, Friday at 9. Others would want to do maybe Tuesday or Thursday at 1 or at 3. I would give you all the opportunity to kind of plan your activity and what that would look like, and help you as best as I can to get you, engaged through that or figure something out. So that's an idea that I have. Addition to that is yesterday on our call with Every Child Reads, which is the new campaign for grade level reading. We were talking about these community-wide window scavenger hunts, and we were thinking about how we could have people put words or letters in their windows. And a lot of us were very interested in it. We know that Bellevue was doing like a bear hunt. So there were bears in windows and people were going through and driving and counting them. So I think someone said they saw 194 bears in windows in Bellevue. And I think that's a really cool idea. So we're trying to figure out what that could look like. And I think we could use some brain power on this, and also just the ability to connect communities together. We all know different people in this community, and just getting ways that we can inspire our friends and families to put up a word or a letter in their windows. And so when I assume many of us, if you're like me, are walking a lot, whether it's with their dogs or just getting out of the house, that this could be a really great way to get the kids engaged and do something fun while also still social distancing. There will also be more of these ideas to come. I am open to any ideas that anybody has, whether that be, something that you yourself would like to do, or ideas that come from the school district. I do ask that you send me an email individually so that I can figure out, who wants to work on what and start coordinating that. And then opportunities for service. So this would be in-person service. So AmeriCorps members who are not at risk or not in a risk category are allowed to serve at hunger-related service opportunities. So that would be a food bank. That could be at nonprofit meal giveaways, things like Project Rooted, St. Stephen's Food Bank, things like that. If those are things that you would like to participate in, just send me an email. Let me know when and where you'll be, so I can make sure that that I know what's going on, and just making sure that you're safe and all of that. But if that's something that you would like to do, it is a need in the community, and we want to help with that, but we also don't want anyone to put themselves at risk. So again, please refer to the COVID-19 policy to vulnerable populations and to the service policy. Sorry, my brain. Next steps. So I will be setting up one-to-one go-to meetings or phone conversations with every single AmeriCorps member. So please expect an email within the next day to schedule this. This is something that I hope to at least do on a bi-weekly basis. It won't take too long, maybe 15 minutes, just to see. I want to make sure everyone's doing well. So in addition to these like updates, program-wide updates, things like that, I want to connect on an individual status to be able to answer any individual questions that you all may have during this time. So look to that email. And with that, I'm going to flip over and answer any questions that you have. So yeah, any questions or anything that I can answer for any of you, feel free to chat it in the chat box, or you can unmute yourself and ask the questions.
Heather, this is Judy. Should we continue to fill out our timesheets even though that we're not serving in our service site?
Yes, do please continue to fill out your timesheets, even if it is blank, and also make sure to count these half hours as service during this time. But please do continue to fill out your timesheets. Thank you for that, Judy.
Thank you.
Hi, Heather. So just so I understand, like we will have to do, if we, like say the school does go back on the 13th, we would need to make up the 4 weeks of time. Otherwise, we have to do the compelling thing at the end of the year if we don't have enough hours.
So the way that that would work is if you wanted to make up that time, if it was even possible, that's the other thing. If it was possible to make up that time and our members, any one of our members had the ability to do that, that would be allowed. However, the likelihood is that pretty much every member is looking at a compelling personal circumstance right now. That's kind of the reality of it. A compelling personal circumstance exit, and I know 6 months ago when I talked about this, you know, it seems like a long time ago. A compelling personal circumstance exit is not a negative thing. It just means that you couldn't complete your contracted hours. So basically, let's say if you did complete 75% of your AmeriCorps hours, then you would receive 75% of your education award. So you get a prorated education award, and that's so you still you would receive, depending on when you're exited, a portion of that educational or that living allowance up until you were exited, and then the prorated education award. But if school does go back on April 13th and you have the ability to make up those service hours, you could definitely to receive 100% of your education award and living allowance and all of that. So, you know, I think we'll kind of look at it come April 13th and whatever the school district decides and whatever support we can be, you know, providing. So if, sorry, I was like, it's kind of a roundabout answer to yes and or no.
Yeah. Okay. Sounds good. Thank you.
Yep. I've got a question from Kim. Can sewing face mask hours count towards member service? So yes, if you are a sewer and you know, would like to sew face masks, we would not be able to pay for the supplies, or at least I will need to find out what that would look like, so I can ask the state for that. But yes, if you can sew and you would like to sew, please do follow the face mask guidelines that Mercy One, and I can find that link, or other places who are medically related have put out for sewing face masks. Please follow those guidelines and not just, you know, anything random that you might find on the internet. Nancy, so when we fill out our timesheets, we submit it with no hours, correct? So currently, yes, you would not put any hours on there unless you have served. So for today, from 1 to 1:30, unless we go with extra questions past 1:30, you would include this as AmeriCorps training on your timesheet. So if you serve any hours, whether it's a teleservice or these meetings, or you spend time talking to me over the phone and related to your AmeriCorps contract, those are all considered hours. So you would want to count them. All right, any other questions? All right, so since I'm not seeing anything, I will start signing off for this. So again, please be safe during this time. Your health and safety matter the most to us in the program, to each other. So practice social distancing, hygiene, all of that. If you are interested in engaging in any sort of teleservice or any sort of service that you may be able to access yourself, please just communicate that to me and I will work with you in all of those ways. So for now, just look for an email to set up a one-on-one conversation with me in the next couple of days, and I will let you all back to your day. Please be safe and please take care.
Okay,
Bye,
you
everyone.
also. Thank you.
Thanks, Judy.
Thanks.
Bye, everyone.
Thank you.
Thanks.
Thank you.